Hey, Brian, let me know when you're ready to hit record.
Go ahead. I think we're ready to start. Just clearing everything up, everybody. Thank you for joining us tonight. My name is Brian Dowd. I am the Deputy Executive Director over Policy Operation and Compliance at the Department of Community Health. And we are doing our evening town hall meeting for October related to electronic visit verification. I know there's not a ton of people on tonight, but we do like to continue to do these evening meetings just to make sure that we have an alternate time for folks. We have a compressed presentation tonight because we wanted to just get questions answered, and there weren't a lot of updates from the town hall that we just did last week at the end of last week. So there wasn't too much to update folks, but we still like to stay with our cadence schedule. So this should be relatively quick tonight, but we will, of course, have a Q&A session. So we start every presentation with the mission of the Georgia Department of Community Health, which is to provide Georgians with access to affordable quality health care through effective planning, purchasing, and oversight. So what are we going to go over tonight? We're going to do our EVV member updates, as we always do now. We're going to give you the project updates. We're going to do common issues and questions. So some things we feel like we need to highlight at every presentation and every association meeting that we go to, or case management meeting, or one-on-one meeting. We're going to give you the third-party EVV vendor update, which is an important point, and then we're going to do our question and answer. So let's start with our member update. Again, we want, if there are any self-directed or consumer-directed members that are on tonight, we want to remind you that public partnership is no longer going to be a fiscal intermediary as of November 1st, 2021. They will be out of the business in the state of Georgia. So if you are in the comp waiver and you are participant directed and you are utilizing public partnership, you should have transitioned to either Acumen or Continuum by this time. And those two different agencies will get you set up with their EVV system. Acumen uses their own system, which is called DCI, and Continuum is utilizing the NetSmart EVV system, the state-run system. They both have been very, very successful in getting their members up and running in the system. There have been some issues and some training that they needed to do, but we continue to work through any of those issues. And it has gotten quite a bit smoother for that crowd. We also like to provide our members with contact information. This is something we heard from self-direction and participant direction, is they didn't know what the contact number was for the fiscal intermediaries. So we're sharing that here. This is direct contact information for all of the different agencies. You have phone numbers and emails for Acumen and Continuum, and an email for public partnership. I believe about 95% of those folks have already transitioned to Acumen and Continuum. So you should be okay with just an email address at this point. So at this point, I want to let the self-directed or consumer-directed folks know, if you are on the line, we encourage you to go ahead and stick around for the rest of the presentation. It is going to be geared a little bit more towards traditional providers, but there will be a Q&A. I want to also remind everybody, both this presentation will be posted to our EVV website, along with a recording of tonight's information. So if you need to go back and listen to the Q&As, or if there's something you miss, I hope you don't feel like you have to take pictures of the presentation, because we make everything publicly available to you. So where are we within EVV? Right now, we have moved the mandatory claims deadline to November 1st, 2021 for all providers. That's both self-directed or participant-directed and traditional providers. So until November 1st, you may continue to submit your claims through the GAMIS system. We strongly encourage you to get every single one of your IDs registered and to be submitting claims right now, because when November 1st comes, you don't want to be caught off guard and not able to get your claims paid. And the only way you're going to be able to continue to bill through GAMIS will be through an open systems ticket for which we have determined that the EVV system is doing something it's not supposed to. So just not being trained or not having experience will not be a sufficient reason for us not to go ahead and put in that claims edit. Also want to just take a quick second to say one thing, which is we've noticed there are a lot of providers out there that have multiple IDs, but they're billing all their claims under one or two IDs. You should be billing claims by location. So if your members are associated with a specific ID number, they should be claimed out of those ID numbers. That is part of the Part 1 Policy and Procedures Manual, and it is an auditable point. So that's something we're really going to be educating our providers on in the next few months, because we are seeing a tremendous amount of providers that have 50, 60 IDs, but they're running all of their billing through one ID number. And that's not how you should be doing it. You should be billing it through the members that are associated with each of those offices. So why did we push the deadline to November 1st? There were three real big things we needed to get into production. One was there were some missing authorizations in the Now and Comp program. That has been fixed as of September 30th. You all really said we needed the rounding rules put into EVV, and we have put the rounding rules in effective September 30th. And then for the Now and Comp program, there were some old Appendix K rate increases associated with the public health emergency that were not reflected in EVV. So we will have that put in place here in the next couple of weeks so that you will be able to, it'll relieve that burden of you going in and updating the rates manually. It'll already be preloaded for you. We also were hoping to get case management up and running by 9/16. That has been delayed. It is currently going into testing this Friday. So we do hope to have that the case management functionality will be up and running for our case managers to have that view-only look into the EVV system later this month. And we will, of course, do training, have related guides and checklists available for our case management agencies or support coordination. So let's talk about a few common issues real quick. Rounding rules. As I said, we put the rounding rules in place. They match the Medicare rounding rules. So it's real simple. Less than 8 minutes is rounded down. 8 minutes or up is rounded up for anything that's 15 minutes. So if you billing in a 15-minute unit, which is all the waivers except ICWP and GAP, they all bill in 15-minute units for CLS or PSS. If you have less than 8 minutes, it will round down. If you have more than 8 minutes, it will round up. So if you check in at 6 p.m. and you work till 6:37 p.m., that means you're only going to get paid for 2 units. But if you work till 6:38, you're going to get paid for 3 15-minute units. Now in ICWP, we pay hourly. So anything less than 30 minutes, you will get paid, it will round up. It will round down. Anything more than 30 minutes, it will round up. So same scenario, 6:38 would be 1 60-minute unit. But if it was 6:15 and it was an hourly billing, then that would produce 0 units. So it's important to understand these rounding rules. Again, the hourly rounding is only in the ICWP program. Okay, employee invitation statuses. If an administrator is unable to schedule a user, an employee, because their name does not appear, you need to check that invitation status of the employee. Administrators are only to schedule with employees who have an invitation status of accepted. If the employee hasn't been invited or the employee hasn't accepted and log in, then you won't be able to assign them. And we're finding in a lot of cases that we don't have those employees who have accepted an invitation and therefore they can't be scheduled visits. That's one we're getting a lot of calls on. There is a short supplemental training video to outline the process, and it is available online. Another big question we're getting, I've gotten several of these today, is, hey, what does it mean when there's an overlapping error either in scheduling or claims submissions. So what that means is your aide has an overlapping schedule with some other place, either within your agency or outside of your agency on EVV. And we're seeing a discrepancy because what you're saying is Brian's going to be working 9 to 5 for Mrs. Smith, and then Brian's also going to be working noon to 8 for Mrs. Jones. Well, they can't do both if they're different agencies, different locations. We understand that in the comp program, there are some shared resources, but we're not talking about that. We're seeing this in CCSP, Source, ICWP, and GAP, where we have staff members that are being scheduled simultaneously for multiple members in different locations, either within your agency or outside of your agency. So if this occurs, you need to write this with the examples, the information to the EVV mailbox so that we can research it and get to the bottom of what's really going on here. Likewise, beware of roster billing. So in the past, we are aware that a lot of providers just build off the schedule and then reconcile that with the worker. You can't do that with EVV because you're clocking in and clocking out. So if you are filling off some spreadsheet or a schedule and putting in reasons why the worker isn't clocking in and clocking out, and then that worker is working somewhere else or for another member, the system will catch that. And it will alert us that this provider is trying to bill 2 times at once for the same staff. All right, let's give you a third-party update real quickly. All of these agencies that you see here, and there are 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. There are 30 different agencies here that are compliant with EVV as of October 1st. So you have 30 different options for providing EVV in the state of Georgia, which is remarkable. I think it's quite an accomplishment and an incredible amount of choice for our providers. The NetSmart system is listed as one of them, and that is the state-sponsored solution, and it is free of charge to you. These other 12 agencies you see here are in process of integration, but we are unclear whether or not they are going to be ready to go by November 1st. So if you are using these agencies, you need to be having a conversation with them to say, hey, are you guys going to be up and running by the November 1st mandatory claims deadline? Because if not, you won't be able to get paid. So I want you to take special note of these agencies. And again, this will be available online. And if you are using one of these agencies, you need to get in contact with them. The following agencies are either chosen not to integrate in Georgia, or they say, hey, we don't have any business in Georgia. We don't have any members who are in Georgia, so we're not going to use your system. So if you are using any of these systems, because there's quite a few, then you're going to need to want to, you're going to want to go back to one of these 30, including the free state option, and start using that, because these systems are not going to work with our EVV system. Okay. Again, I said it was going to be a relatively abbreviated town hall tonight, just given how many town halls we've had in the last couple of weeks. So we were able to get through that in a good 15 minutes. Let me check the Q&A and see what we got in there. So we do have some questions, so that's great. The first is, we are a PSS provider. Do we need to print the visit report to let registered nurse to sign? Yes, you need to print the visit report. Anything that is not captured in EVV, and if your system does not have a nurse's signature and the NetSmart system does not, you will need to print out the visit report so that the nurse can sign it for auditing purposes. Anything that is in the system, the auditors will have access to, and it should be fine for the purposes of auditing. Next question, if the member's frequency is 5 hours, 2 days a week. The caregiver works 5 hours, 30 minutes one day. Can she work 30 minutes in the other day? Yes, she can work less 30 minutes in the other day. That is fine. We understand that there are some schedule variances like that. That is not a problem at all. Will the employers or the employers have a login, not the participants? So every employee has a unique login and a password to log into the EVV system and clock in and clock out. All right, hold on one second. Let me check all of my available resources here, make sure if there's any other questions. So let me also encourage you all, if you do have questions, to contact the call center. If you're missing members, if you've got any system issues, you can reach out to the call center and they can provide you the training resources you need. It is here at 833-701-0012 and via this address. A couple more questions have come in. Or one to chat. If you schedule a caregiver from 7 to 3 and they clocked in 7:30 to 3:30, is that acceptable? Yes. Again, we understand that not everybody sticks exactly to the schedule, and that is not a big deal. If there are repeated variances from the schedule, you may want to consider updating your schedule. Okay, I'm going to give it just a second to see if there's any other questions that come in the Q&A. Would love to know where you found the CMS approved rounding rules for reference, if you can provide that. We currently round as you referenced, but would like to reference CMS guidelines for other states who are not following those guidelines. They're on the CMS website. You can just search the CMS website and they give you the rounding rules. That's all we did. They're standard Medicare rounding rules. All right, I'm going to give it just a second. Yes, the one last question here, and then we'll be done. Is I was told you have to submit the schedule through the app. The app allows the caregivers to update the schedule as needed. However, there should be, from the administrative side, a scheduled time for service. So there should be a base schedule that is put in by the administrator. If you are having issues with that, you can call the call center and the call center will provide you the training resources that are available for that. But again, there should, and that's a basic component of HCBS waiver programs. You have to have a schedule, because what we're providing as a state through taxpayer funded dollars is to meet an unmet need for your care to avoid institutionalization. And you can't really meet a need for unmet care unless you know what the schedule is when you have an unmet care need. So you have to have a schedule. That's a question I've gotten a couple of times, which has been an interesting one. Like, why do I have to have a schedule? And the response is, if you don't have a schedule and an unmet need, you shouldn't be on the program, right? So it's really important that we have that schedule so we know where that unmet need needs to be filled. But the app, to your question, which is a great one, and I always get great questions and great comments through the town hall, so we really do appreciate you guys participating, is where schedule variances can be done. You can update those schedules on the app. So thank you very much for that question, and all the questions and comments we got today, and all the questions and comments that we always get through the town hall. They are very useful and they are very helpful in us improving the process for this federal mandate. So I'm going to go ahead and end tonight. We had a bit of a quick session, but that's a good thing, only 20 minutes. Again, this is the EVV resources. Please keep up with the stuff that's on the website, all of our EVV information that's on the website, and utilize the EVV mailbox as needed. Thank you, and I hope you all have a great night. I'm sorry, I put myself on mute a little too quick there. Thank you.